Good afternoon. Now this is the introduction to part, introduction to the anatomy. In previous lecture we have studied about the different terminologies of the means related to the terminologies related to limbs. What is anterior, posterior, about the definition of the anatomy, and what is the word dissection means, and then there we have learned about the different subdivisions of anatomy. Like suppose gross anatomy is there, one has to study for the histology, and then there is embryology, neuroanatomy, subdivisions of the anatomy we have studied. Now in next to that, then we have studied about the different planes, position of anatomy means positions, different positions we have to use, and we have to teach that what is anatomical position, what is prone position, supine, different planes are there, sagittal plane, coronal, then what is about the transverse plane, horizontal, and then again some basic concepts about what the introduction chapter related. And now this is the introduction to myself, Dr. Avantika Sri Krishna Bamne. I am professor in the Department of Anatomy, Index Medical College, Hospital and Research Center. Now in today's topic, what else has to be covered? So here the different terminologies used for the limbs means what is the anterior, posterior, superior, inferior. Then some terminologies which are used in the embryology, like suppose what is ventral aspect of the body, what is dorsal, what is ventral, and then superior, inferior. Similar terminologies used in the gross anatomy: ventral, dorsal, cranial or rostral, and caudal. So these are commonly used in the embryology development, during the development when we study development of the human embryo. And then so for the limbs again, so there are the plantar aspect of the what is plantar aspect, what is palmar aspect, then what is radial border, ulnar border, pre-axial, post-axial, terms used for describing movements. So now here the terms used for describing movements are, so the movements which are done by different muscles, which are the flexor muscles, which are extensor muscles, the muscles doing abduction and adduction on a particular plane. These all the movements, they are occurring at different joints. Suppose let's take the shoulder joint is there, shoulder joint, then hip joint. So at the different joints, which are different movements performed by the contraction of muscles. And the movements also, when if suppose take example of synovial joint, like shoulder joint, which is highly mobile joint, and how uh, the flexion and the extension that is taking around the anteroposterior plane, then abduction and the adduction, circumduction, medial rotation, lateral rotation, and what is the circumduction, combination of all as well as axial rotation of the particular bone. So that means suppose for example clavicle. So these terms, they are describing the movements taking place at joint. So now here when some here the movements of shoulder joint, this diagram is showing suppose movement of the shoulder joint. So here when the arm upper extremity, when it is coming towards the axis like this, and now this is the flexion, decreasing the angle between the anterior aspect of the thorax and upper limb. So this is the flexion. In the same way, when this upper leg is extended behind, and this is the, so this is the flexion, this is extension. So how extension is described in this diagram? So flexion and the extension, then there is the flexion and the extension, At back of the knee joint there is flexion, and of the thigh front of the thigh and front of leg region there is extension, and back of the whole portion of thigh as well as leg region. So this is the extensor compartment of the lower extremity, back compartment, posterior compartment, and then this is the, now how again dorsiflexion here, dorsiflexion and the plantar flexion it is occurring, and then again here flexion and extension of the fingers taking place, means digits taking place at, suppose different small joints of the hand. Suppose this is the flexion and this is extension at metacarpophalangeal joints. Then suppose here is the flexion, here is the flexion, and this is extension which is taking place at the interphalangeal joint, proximal and distal interphalangeal joint. So these are the flexion and the extension movements. Now for the abduction and the adduction movements, whenever the limb which is coming close to the towards the axis of the body, that is described as adduction. When it is going away from the axis of the body, so that is called as the abduction, adduction and the abduction. And always the rotation that is taking place, so here the rotation that is taking place in a vertical axis, around the vertical axis of the long bone. So vertical axis of the own, means own vertical axis of its bone, suppose here is the humerus and its vertical axis, now around which the rotation, that is medial and the lateral rotation, the movements they are taking place. So now here different movements they are described for the first carpo-metacarpal joint, that is the thumb is there. Okay. So now here thumb is showing movement. Now how extension of the thumb, and then this is the flexion and extension in a same plane. Then there are the abduction and the adduction and opponents, opposition, and then here is the abduction and adduction. So this is flexion, this is extension, this is adduction, this is abduction, this is abduction, this is adduction, this is flexion. In the same way, this is extension, then this is adduction, abduction in a same plane, circumduction, and then here is the opponents, then fanning of the fingers. This is the abduction is described for the joints of this hand. Now in the hand, in the palm, this middle finger is acting as axis around which the action takes place, and now this is the abduction, means these two fingers digits they are going away from the central this axial line of the palm. So this is abduction and this is adduction. So that's how different movements they are described when we study the separate joint during the gross anatomy lectures. Now what is again related to the, what is supination, what is pronation? So this is the pronation and this is supination. So supination and the pronation movements they are taking place around the superior and the inferior radio-ulnar joint. Pivot type of joint is there, and that is the different movements, supination and the pronation. Now here one set of movements here described again. Now this is the inversion and eversion. So how different movements they are described in terms to the upper extremity and lower extremity, all the joints in the body. Now inversion and the eversion, the joint they means these movements, these are taking place, the movements are taking place at the small joints of the foot. Not, these movements are not taking place at ankle joint. It is, ankle joint is hinge type of joint and only dorsiflexion and plantar flexion movements are taking place, while over the means of the inside the small joints of intertarsal joints and small joints of the foot, so there the this movement is taking place, that is inversion movement and eversion movements. So these movements they are taking place with the help of muscles, how the muscles they contract and produce different movements and how they act on the joints. So inversion, So it is described, suppose let's take example and have just a definition in one single line, that lateral border of the foot is on the ground, medial border of the foot is raised above the ground level, so that sole of the foot, that means plantar aspect of the foot, faces medially. So that is the inversion movement. Then here eversion movement, opposite to that eversion movement, lateral border of the foot is raised above the ground level, so that sole or plantar surface is facing laterally. Now these inversion and the eversion movements, they are very helpful for and occurring at the calcaneocuboid and talocalcaneonavicular joint. These are the mid-tarsal joints, and it is again very helpful for the during walking. Now certain other terminologies used, suppose hollow organ. Now we have studied about the terminologies related to the limbs, then again for different joints how the movements they are taking place, and then so what is for the hollow organ. So what to describe about the hollow organ. So inside the, when we have to see inside the interior of any hollow viscera, suppose there is stomach is there, intestines are there, liver is a solid organ, but suppose for the any organ who is having, which is having cavity, means so hollow viscera or hollow organ, suppose there is stomach is there, then intestine, urinary bladder, so whatever that is inside, that is called as interior. From outside of the organ, that is exterior. When something is coming out of the cavity, so that is evagination, and something is turning inside, that is the invagination. Now again for the solid organs, the terms superficial and the deep, the terminologies they are used, superficial and the deep. So how the superficial and the deep, solid, for solid organs, suppose, so when we palpate, person is lying on a supine position. The person is lying on the supine position, and now as a clinician always stand on the right side of the patient and start palpating the abdomen. So for suppose we assume that the person came to the OPD or emergency, that is with the acute abdominal pain, and then clinician has to observe for means just doing examination by palpation, and then he start palpating. So the organs which are just near to the skin surface. So suppose on a right side there is liver, then on left side there is stomach, then just below the stomach on left side again there is spleen, then on right side there is liver. And now what happens, so these are the superficial organs, no doubt, and some organs they are placed deep, such like suppose kidneys. So kidneys, they are now just on each side of vertebral column, in paravertebral gutter they are placed, so they are the deep organs. And superficial organ, liver. Terms used for to indicate the side. Now what is the ipsilateral and contralateral? So contralateral means when body is divided into right and left equal halves by median plane or mid sagittal plane, and so anything which is on the same side of the body, that is called as ipsilateral, and anything which is on a opposite side of the body, that is contralateral. For let's take example, suppose 80 to 90% of the subjects they are right-handed people, and in case of the right-handed people, now out of two cerebral hemispheres in a right-handed people, so there is dominant hemisphere is left cerebral hemisphere is dominant in right-handed individual, so contralateral. And ipsilateral means suppose we have to explain anything in on a same side of body, that is the ipsilateral terminology. Now the terms used for describing the muscle. So now muscle, word that is coming from the Greek and the Latin word, and how the muscle that means the mouse means, suppose any muscle, now suppose mm, imagine that it is having origin which is placed almost for all the muscles, means except few, the origin that is superior attachment, insertion means that is inferior attachment, in between two whatever the muscle mass we can feel, that is called as the muscle belly, and the tendon. So towards the insertion, that muscle fibers now, and now here there is junction of the aggregation of collagen fibers are there, cord like tendon is formed, and that is called as the tendon, which is at the time of, which is end of the muscle, where it is attached at the site of insertion. So now what is origin, what is insertion, what is belly and tendon? So in this structure of the any muscle, very commonly it is described in terms of, it is looking like a mouse, so therefore muscles. Now what is aponeurosis and what is raphe? Now here again we can describe that. Now suppose this is the scapula, this is upper extremity. Now here everyone knows that this is the biceps brachii muscle, and then there is the triceps brachii muscle. Now here is the biceps brachii muscle again. To describe the terminology, in 12th class only we have studied biceps, that means bi means two, seps means head, heads. So the muscle which is having two heads of origin, that is called as the biceps. To describe that particular muscle, suppose here three heads of origin, then it is called as triceps. Tri means three, and the seps means heads. So now, so here origins they are described. Now see, means we can see the attachment here, coracoid process of the scapula is there, and then here is the so now this is the coracoid process of the scapula. Then here is the acromion process of the scapula. Posterior there is the spine, and now here is the glenoid cavity. In the glenoid cavity, and then how there is the supraglenoid tubercle. So supraglenoid tubercle is there, and then there is the coracoid process of the scapula. So therefore, now so here the origins. So these are the origin. Now this is the muscle belly. Now at the over the radius, radial tuberosity, there is insertion. At the insertion point, this cord like tendon is formed. This is solid cord like a very regularly arranged collagen fiber bundles, and then it is very strong, and this is the tendon. So now origin and the insertion means superior attachment and inferior attachment, and in middle this is the muscle belly part, where the muscle fibers, actual muscle fibers we can feel when. Now what is the action of biceps? So supination, and also it is muscle of the front compartment, flexor compartment of arm, so it is doing flexion and it is doing supination. So now the C flexion, so decreasing the angle between front of forearm and front of arm. So this is the flexion movement is described, and now this is the flexion, and then now see how, so muscle movement is taking place. So when muscle comes into the action, and whatever the muscle belly that becomes taut, and it is in the contraction state, and we can palpate, we can feel that muscle, and so this is the muscle belly. So origin is there, insertion is there, muscle belly is there, and then tendon, how, what is tendon is there. So these are the terminologies related to the muscles. Terms used for describing vessels. So which are the terms used for describing vessels? So there are the in cardiovascular system, which consists of the heart as well as the blood vessels are there. So what are the arteries? What are veins? The structure. Then capillaries are there. Anastomosis. So arteries, they are the thick walled. Lumen is maintained. Pinkish color arteries, and usually the elastic wall is there. And then arteries, they branch like trees. Large artery, divided into the large artery, suppose here subclavian artery is there, now called it as conducting vessel, which conduct the blood from heart to, and now it has to supply further. Now so here now the large elastic artery, mm, that is divided into the muscular artery, small sized muscular artery. Then again branching takes place, and when it comes up to the 100 micron lumen, then it is called as the arteriole. And again the arterioles, they divide, and then up to what level? So suppose 7 to 8 microns diameter when they reach, and then means branching process, and then they are called as the capillaries. So capillaries are there. Okay. So arteries, so from again the veins are there. Again arteries, they carry oxygenated blood from the heart, and they supply oxygenated blood to the different parts of the body. So all the arteries in the body, they carry oxygenated blood to the different part of the body from heart, except two arteries, pulmonary arteries and umbilical arteries, which carry deoxygenated blood. Now, which are the veins? Though as compared to the arteries, the veins have thin wall in their tunica. Okay, so thin wall, and they are um, low pressure, lumen often collapsed, bluish in color, and these are carrying the veins carry deoxygenated blood from the heart. Veins, they carry deoxygenated blood, and they are carrying towards the heart. So that is, it is also called as the venous return to the heart. So veins, all the veins, they carry deoxygenated blood except pulmonary veins and umbilical veins. These both veins carry deoxygenated, oxygenated. All the veins carry oxygenated. All the veins carry deoxygenated blood, but only the pulmonary veins and umbilical veins are those. Two veins are exceptions which carry oxygenated blood. Umbilical vein carries the oxygenated blood from placenta towards the fetus, and pulmonary veins carrying the oxygenated blood from the lungs to the left atrium. So now capillaries are having the diameter of 7 to 8 microns, so that say in a single file the RBC can move, and then there is the anastomosis between the arteries and the vein. So standard color scheme applicable to the anatomical drawings. So now here arteries, they are, so we have to draw in the gross anatomy with color pencils. Draw the artery with red color having the lumen. Veins, blue color. Again lumen one has to show. Then nerves, they are the solid structures, so either yellow color or black color. Lymph vessels, lymph, violet color. Muscles, pinkish brown color. Then bone, suppose yellow color again, and cartilage, that is the sky blue. This is the color code used for. Now terms used for describing bone features. So what are the elevations? So suppose for the bone, linear elevation, that means it can be line, or it is also called as lip, ridge or crest. So again with the means when during the skeletal system lecture, linear elevation, that is described. Sharp elevation may be a spine, styloid process, cornu or hamulus. Rounded irregular elevation may be tubercle जैसे कि for example suppose for the humerus there is greater and the lesser tubercle, then there is tuberosity, greater tuberosity, lesser tuberosity, greater trochanter, lesser trochanter, then radial tuberosity, ulnar tuberosity, tibial tuberosity, epicondyle, um, medial and lateral epicondyles. There are the small elevations over the condyles of femur, so therefore ep means above, malleolus or trochanter as we described, malleolus or trochanter. So therefore, so these are the different elevations how they are used for the bone features. Okay, so what is linear elevation? So in the introduction to topic also again different terminologies related to the limbs we have studied. Then what happens, uh, movements which are taking place in at different joints. Suppose synovial joint is there, it is highly mobile joint, so either the biaxial joint is there, uniaxial joint is there, or multi-axial or polyaxial joint, simple joint or compound joint, according to what the different movements we have studied in this introduction chapter 2. And then so what, flexion extension around one plane or around 1 degree of freedom, abduction and adduction movement taking place around another degree of freedom, and medial and the lateral rotation. So suppose for freely mobile joint, like suppose for example let's take example of the shoulder joint, it is multi-axial ball and socket type of joint, and all the type of movement, flexion, extension, medial rotation, lateral rotation, mm, and abduction and the adduction, all the movements they are taking place at different planes and around the different axes, so that we can say that it is having 3 degrees of the freedom. Okay, so that is the movements of the joint, they had it is described. And then there is the terminologies related to muscle. What is origin of the muscle, what is insertion of the muscle? Origin always it is placed superiorly, insertion it is placed inferior, attachment is also called as inferior attachment, insertion, origin is called as the superior attachment. But the sentence it will not hold true for each and every muscle, because so here is the sternocleidomastoid muscle in the neck region, here is the sternocleidomastoid muscle. So to the mastoid process which is behind the ear, so there is the insertion, and here in the clavicle, over the clavicle and over the sternum, so there is the origin. So two heads of origin for sterno, how muscle name is also there, sternocleidomastoid. That means one attachment or origin is from the sternum, then from the medial this medial end, medial two-third of the superior surface of medial two-third of clavicle, clavicular head, sternal head of origin, sternocleido, and then it is going towards the mastoid process for insertion. So insertion is situated above and origin is below. So therefore origin and the insertion, that means origin is superiorly placed, but except for the sternocleidomastoid muscle. So for relation means to related to the muscles, how the terminologies they are described, then different blood vessels, then we have to study, see how blood vascular system consists of the important medium blood is there, and how the which are the structures through which the blood it is flowing, means some blood vessels. So artery and its accompanying vein, they are called as the blood vessels. So suppose femoral artery is there and its accompanying vein, that is the femoral vein. So artery and the vein, they go hand in hand, and that is called as the blood vessels. They are called as, together they are called as blood vessels. And when nerve is again coming in together with the blood vessels, and when femoral nerve is also there on the front of the thigh, there is femoral artery, its accompanying vein, femoral vein, and again in a bundle there is femoral nerve also there. So therefore these three so structures together, they are called as neurovascular bundle. So say only artery and vein, it is called as blood vessel, and when nerve comes and join with them, and then it is called as the neurovascular bundle. Thank you.